Okay, we're preparing this tape to give you an overview of what you can anticipate happening and what you can expect with your total knee replacement. In general, the purpose of a knee replacement is to improve function and to relieve pain. The appropriate time to do your knee replacement is when the condition of your knee is no longer tolerated and no longer responding to non-surgical treatments. And this is something we've discussed prior to you viewing this tape. A knee replacement is somewhat of a misnomer. We don't actually remove all the structures around your knee. In a knee replacement, what happens is the very ends of the bone are resurfaced with metal and plastic. Very little bone is actually removed. And by removing surgically the abnormal arthritic surfaces and replacing that portion of the joint with metal and plastic, your pain will be relieved and your function will be significantly improved. Now this is a model of the human knee. The bony structures here are actually clear glass, and this part up here is your thigh bone or your femur. This part here is your kneecap or your patella. And this part down here is your tibia or your lower leg, and where the thigh bone, the femur, meets with your shin bone or the tibia of your lower leg, that articulation there is the knee joint. And as I'm bending this model back and forth, you can see how that knee joint flexes and extends and how the kneecap here interacts with the knee joint itself. A knee replacement does not actually replace all of this, what you see here. We're not replacing from here down to here. What we're doing is actually removing the arthritic surfaces on the very ends of these bones, the thigh bone, the kneecap, and the tibia down below. We're actually removing those arthritic surfaces and placing a new surface over the ends of the bone to create a new articulation. And on the femur, which is the thigh bone, there's carpentry work done to create a surface that will accept the metal implant. And that metal implant, I can separate these pieces away. You can see this metal implant here. This is what it looks like from the side. This is what it looks like from the front. And this is an anatomical resurfacing or recovering of the end of your thigh bone that creates a nice, new, smooth, shiny surface to replace the worn out arthritic surface. This is what goes on the end of the femur. And on the opposite side, on the shin bone or on the tibia, this is the piece that's placed there. This is actually made of metal and plastic. The white part here is the plastic. And so the very end surface of the tibia or shin bone that articulates with the femur is removed. This piece is inserted by a stem into the shin bone or the tibia, and it now creates a matching surface with which the femoral piece on the shin bone can articulate. And this is what this articulation looks like. The purpose of this stem here, or what looks like a post or peg, that is there to provide some stability to the knee, and actually is a plastic piece that functions to replace the normal function of the cruciate ligament within your knee. All the other structures around the knee, the capsule of the knee joint, the other supporting ligaments, the muscles around the knee, those are not removed and those are not disturbed during the operation. So we're removing the old arthritic surfaces, we're replacing them with metal on the femur and plastic on the tibia, which now creates a normal anatomical replacement of the normal human joint and an articulation that will function and operate in a smooth and efficient fashion that should remove your pain. The third component of a knee replacement involves the kneecap. That's this piece here. Your kneecap is not removed, but the very surface of it is replaced with a piece of plastic, which is this piece, this circular piece right here. And that is also inserted into the native kneecap bone through small pegs and cement, and then that is allowed to articulate with the knee in this fashion. So the finished product looks, as you see here, you can see how the three pieces, the kneecap, the femur, and the tibia all interact with each other, and that's basically the concept behind what will be done with your knee. The correct time to do the knee replacement, as I said, is when you're no longer able to tolerate the condition that exists in your particular knee. Once you've made that decision to have the knee replaced, what will then happen is you will need to be evaluated by your medical physician to make sure that there aren't any medical issues or conditions that might prevent you from undergoing the surgery. Assuming that there are no issues of that type, arrangements will be made for admission to the hospital. You will generally come into the hospital the day of your surgery with knee replacement surgery. Most people will need to stay in the hospital for 3 or 4 days after the surgical procedure. The surgical procedure takes approximately 1.5 hours. It's a procedure that does not associate itself with a significant amount of risk. However, with a knee replacement, unlike other joint replacements, the surgery for the patient is oftentimes painful, and the rehabilitation can be difficult for some people. In joint replacement surgery for the hip or the shoulder, the surgery itself is actually more complicated, but the recovery is actually easier for the patient. So in your instance, you have a problem that is actually easier for the surgeon to deal with and address, and the surgery that's performed is actually technically less difficult for the surgeon, but for the patient, the recovery is more prolonged and more painful during the initial stages of that recovery. The surgery will be done the day of your hospitalization. As I said, it will take approximately 90 minutes. After the surgery, you'll be in the hospital for 3 or 4 days. That length of time is determined by the amount of pain you're having, and is also determined by your decision as to whether you'll be going directly home from the hospital or into a rehabilitation facility. The surgery itself does not have a great deal of risk. There are certain things, as there are with any surgical procedure, that can go wrong that would be considered complications. The biggest risks of a total knee replacement procedure would be the risk of phlebitis, which is the development of blood clots in the leg. To prevent that and reduce the risk of that, you will be on a blood thinner, which is started after your surgery and continued for the first 7 to 10 days after the surgery. The second thing that can happen, which would be considered a risk, is the development of infection after the surgery, which can occur relatively soon after the surgery or can occur at any point after the surgery, even years later. An infection is probably the worst thing that can happen after a knee replacement or any joint replacement, and when infection sets in, that generally necessitates further surgical procedures to eradicate the infection. The risk of a blood clot developing or the risk of an infection setting in is very small. Infections occur in less than 1% of people. Blood clots do develop in probably between 1 and 2% of people. In a very rare situation, that blood clot can travel to the lung and actually be life-threatening. The risk of that happening where the blood clot travels is well under 1%. The other things that can happen after surgery that would be considered complications are the development of stiffness in the knee and difficulty regaining function. A small percentage of people, perhaps 1 to 2%, develop enough scar tissue in the knee that then requires a manipulation of the knee during the first 6 or 8 weeks following the surgery to free up the adhesions and to improve the function. That is not a common occurrence and something that we try to prevent by starting physical therapy in the hospital and continuing it very aggressively after the surgery and after your discharge. The things that can happen during the surgical procedure that are extremely rare would be the cutting of a blood vessel, the cutting of a nerve, the fracturing of the bone. These are intraoperative complications that can can potentially happen, but these are extremely rare and highly unlikely to occur during your operation. Statistically, 95% of people who have knee replacement surgery are very happy with the outcome. The purpose of a knee replacement is to relieve pain and restore function, and fortunately in 95% of the patients this is exactly what happens. Approximately 5% of people statistically that have their knees replaced are not happy with the result. There can be a variety of reasons for that. Included in these reasons would be if you develop a complication, one of the complications I've already mentioned. The likelihood of any of those happening is extremely small. The greatest majority of people who are unhappy with the result are unhappy for reasons which we can't determine. It's generally not because of a complication, and there are probably 3 or 4% of people that have knee replacements that continue to experience discomfort or stiffness or pain or chronic swelling in the knee. In most of those cases, we cannot determine the reason for that. The chances of that happening is small, but is something you need to be aware of. Most people stay, if they go to a rehab facility, will only stay there for 4 or 5 days. Once you do eventually arrive home, your therapy will continue. The typical duration of therapy will last anywhere from 6 to 12 weeks. The average patient will take somewhere between 6 and 12 weeks before they're really happy with the procedure and glad that they actually made the decision to have the procedure done. Most people during that first 6 to 12 week period of time will be uncomfortable and be inconvenienced by going through the rehab, and many people actually question why they had the surgery done to begin with. But once you get over that hump and through that period, you'll be very happy with the result, and you'll be able to get on with your life. There'll be continued improvement beyond the first 6 or 12 weeks, and most people continue to see improvement up through the first year. In terms of resuming your functional activities, you're allowed to resume normal function at any time when you feel you're capable of doing so. This just depends on your progress following the rehabilitation and during the rehabilitation. The blood thinners that will be used following the surgery will be relied upon for approximately 10 days. At the end of 10 days, a scan will be performed on your leg to ensure there are no blood clots. And if that scan is okay, then those blood thinners are discontinued. During your hospital stay, I will rely on the assistance of a physician's assistant. That physician's assistant will assist me in the operating room. I will be performing your operation. However, following that, the physician's assistant will be seeing you each day following your surgical procedure, ensuring there are no problems. You will not actually see me during the hospital stay other than in the operating room. And the next time you would see me after the surgical procedure would be back in my office, and that would be 10 days after the surgery. If at any time during your hospital stay there are any problems or concerns, the physician's assistant would be immediately in contact with me, and I would immediately come into the hospital to address those issues and meet with you to ensure that the ultimate outcome from your procedure is what we want. I think at this point, this will cover most of what you need to know about your surgery, and after you've had the opportunity to view this tape, you and I will sit down again and we'll further discuss any questions you might have and go over any of the particulars involving the surgery that need to be addressed. Thank you.